all. Today I'll be talking about a little bit of a different topic from my usual topic of cancer, blood disorders and blood cancers. So most of you might have been encountered with this situation. You might know family or friends who might have encountered these situations where a doctor has recommended a medicine, especially if it's an injection, and a particular price has been quoted for you, and you find out from the community, you talk to 3-4 pharma distributors or other people that you may know about, and you get to know that the medicine is available for half the price some other place. It's but natural to think, Arey, I'm saving so much money. Why not get it from this person? I'm sure that this person is giving it at a very low cost, whereas that person is trying to make a huge profit out of the medicines. So wait right there. So this is a word of caution. When you have to take medications, whether it is antibiotics, whether it is medicines that change your disease performance, like chemotherapy medications, even if it is multivitamin injections, if it is injections like iron, be very cautious who is giving you that medication. If the medicine is coming from a trusted source, as in if the distributor has been in the market for a long period of time and they have experience about how to handle these medications, then those are the trusted providers that I would advise you go with. What is the reason? So all medications, just like to put it into a normal scenario, some vegetables can be stored at room temperature. Some vegetables will last for at least 4-5 days only if you put them in the refrigerator. There are medicines that are very similar to these vegetables. Some medicines are stable, though their chemical composition is stable at room temperature. Some medications at room temperature will completely lose their stability and actually become toxic to the body if not stored at the right temperature. It's very, very important to store important medications according to the instructions that is given on the medication's label. And it's not just maintaining it for say 1 or 2 days. Medicines that have a long expiry date, so something is made in 2024, they expire in 2027. So which means that medicine has to be maintained in the right temperature, in the right conditions for 3 years. It's extremely important that the right precautions be taken and the correct protocol is followed so that medications, composition does not change. When erratic temperature changes, if during transportation medicines are not transported in say ice box or in the right conditions, in the right cold temperatures that is required for the medicines, their chemical composition completely changes. In which case, what would be happening? You are paying the same price that you would pay, maybe you're paying a lesser price than you'll be paying another distributor. But if you're taking a medicine that is either not going to work because the chemical composition has changed. In fact, something reverse might happen, as it might cause severe side effects or toxicity because the medicine's composition has changed. That is you putting your life at risk for a few rupees. So be very cautious. Who is your distributor? Where the medicines are coming from? Who is the reason we as doctors recommend a few brands or a few providers is because we have used those brands or those providers or those distributors for a long period of time, and we have developed a certain amount of trust in the way these people are able to maintain the protocol and ensure that they deliver the medicines to us in a safe way. Only then we go ahead and trust enough to prescribe these medications to our patients. When we are not able to trust the way the distributor has maintained this cold chain or the right protocol has it been followed or not before the medicine has been delivered to us, it becomes extremely difficult for us to say, okay, I can trust and give this medicine because it can cause reaction, it may not work, it may cause a lot of adverse reactions or side effects, and the patient is going to blame the doctor. Patients don't think about what has happened between the manufacturing of the medicine and the way and the time when the medicine has actually been administered to them. Because as I said, a lot of these medicines have what we call a long expiry, as in they are made maybe a few months to even 1 or 2 years before they are actually administered to the patient. And if the right protocol is not followed, they can turn out to be quite toxic or ineffective, even if they are prescribed in the right way by the doctor. Be extremely cautious, just like you're extremely cautious in picking your doctor, the facility where you're taking treatment. Just like that, be extremely cautious about which company, which distributor, the person who's supplying the medicine, and is it really a trustworthy source that is supplying the medication to you. Be very cautious of these things because all of these is important when it comes to your medical care because it's your health you're talking about. If you have any questions or queries about the right way to maintain medications, the right way to supply medications, how to pick the right place or right distributor, please feel free to reach out to me. I'm Dr. Neema. I'm a senior consultant hematologist, hemato-oncologist and pediatric oncologist.